I'm Mo. I'm a UK-trained ophthalmologist, so I trained in the UK. I've always been interested in the field of ophthalmology and eyes from a very young age. I actually went to medical school at the age of 15, and I graduated as one of the very youngest doctors in the UK at the age of 20. That was followed by 10 years of training in the field of ophthalmology, and that's what's taken me to a revision here today. And in terms of ophthalmology and eyes, it was again something I was fascinated with, mainly because I was wearing glasses from a very young age. In fact, you might know that I've already had laser eye surgery myself around about 8 years ago. So it's been a fascinating mix of medicine, physics and technology that's taken me to the field of ophthalmology and laser vision correction. The most important or emotional patient I was dealing with at revision over the past few months was an elderly lady, over 90 years of age, who had basically become housebound because she had lost all functioning vision in her only good eye because her cornea had become cloudy. She was referred to me from out of town, a 5-hour drive away, because in revision we're able to offer state-of-the-art corneal transplantation, and she was basically told that she had to wait up to a year to get that transplant done elsewhere. She came to us in June, had the surgery with us in the form of a corneal transplant, and she was able to see again and function independently within a space of 5 days. So she was very grateful. Her daughters were obviously very grateful that this 90-year-old's vision was restored so quickly so that she could basically gain her independence and live the kind of life that she wanted to at that age. Sure, I think the main difference is the family feel that we bring to patient care. A lot of our patients comment that instead of being in kind of a factory setting where they're taken in to see a doctor and then taken out the room in a very short space of time, they feel that we provide a family-based kind of care where we treat them like our parents and our brothers and sisters. I think first of all we should mention that Dr Ziaei is a leading ophthalmologist in New Zealand with a great number of patients and a great number of following. I would also say the location of our premise is actually in an ideal location, but I would also say the technology that we utilize in the practice is state-of-the-art, and I would say that it's something that I would like to have my laser vision correction done with these instruments if I were to have it again.